What's up, everybody? It's Dr. Michael Mash with Barbell Rehab. Welcome to the first Pain Points video. We are just starting this new video series. It's going to be up on YouTube, up on IGTV, where Dr. Miles Nicholas and I are going to be talking about the hottest trends in pain, rehab, and performance going on right now. So, super excited to have Dr. Miles Nicholas with us today, lead instructor for, or one of the lead instructors for our Barbell Rehab Method certification course. So, first thing we're going to talk about, well, before we even get started, Dr. Miles, why don't you introduce yourself? A lot of our audience may have seen your pretty face on Instagram, but why don't you introduce yourself and tell us where you went to school and what you like to do.
Cool. All right. Hey, everybody. I'm Miles, Dr. Miles Nicholas, and I'm now teaching along with Mike for the Barbell Rehab certification. So I went to Northeastern University up in Boston, Massachusetts, graduated in May 2019, worked up there for 2 years, and now I'm down here in the Pittsburgh area working as a float physical therapist, which is very exciting and has taught me more about both how I want to treat and definitely also covering other PTs, sometimes how I don't want to treat. But I've learned a lot, and I love coaching, I love rehab, I love working with throwers, any recreational fitness athletes, and anyone who's got goals to get back to doing some good exercise. So here we are.
Love it, love it. So today we're going to talk about one of the biggest questions that I often get at Barbell Rehab, and it is this. And we bring this up in every single live course because, in my opinion, it's an elephant in the room that's not talked about quite enough. And if you've been following any of the latest research into pain, there is this push to not necessarily normalize it, but kind of normalize it, right? That, hey, pain is unavoidable, right? It is a normal part of living. Obviously, we can do things to minimize it, but pain-free isn't always the goal, right? Do you want to speak on that for a little bit before we get into the topic?
Yeah, so I think on the topic of pain-free isn't always the goal.
Yeah.
I think a really, big, again, elephant in the room is that sometimes pain-free isn't even attainable.
Yeah.
So if we know that there are people out there that are living with persistent pain, and that we can either help these people live well or not live well with their persistent pain, I think that's a really good place to start.
Gotcha.
And then furthermore, obviously as rehab providers, our goal is to maximize function and help someone work back to no or very minimal pain. So in general, we're always going to try and help set the client up, the patient up sometimes, depending upon the setting, for no pain, high function. But I think the reason, more than any other reason, why we really have to focus on function and helping the person live well is because sometimes we won't even be able to get them out of pain.
Exactly. Yeah, so you put that really well, and it bridges nicely into the topic of today's video is what can fitness professionals, personal trainers, strength coaches, really do to help their clients in pain. So if we assume that, okay, let's take a patient that has gone through physical therapy, right? And they had a really good physio, right? Somebody that is up to date on the latest biopsychosocial trends, biopsychosocial model. And let's say that this client is not quite pain-free. Maybe the exact client you were just talking about, maybe pain-free was not attainable for this person. And now they're working with a personal trainer. What within the scope of personal training, if we know that the prevalence of pain is so high and it's not necessarily something that needs to be avoided, we talk about this every course, we like to empower personal trainers and strength coaches for how to work with clients that have had persistent pain. Maybe in that in-between phase, they've been discharged from physical therapy and now they present to the personal trainer. Let's talk a little bit about what is the role of the fitness professional and how can a fitness professional really help a client that is dealing with pain? Do you want to start?
Yeah. So, I think it really is dependent upon the context. So I'd say, kind of going off of what you said, why don't we start with the context of someone who graduated physical therapy and is still dealing with some pain, but whether they ran out of insurance visits or whatever it is, now they are working with you. I think in general, if you can have collaboration between the fitness professional and the physical therapist, that's great. What I will say is, in practice, that's often not the case.
Yeah.
So as the fitness professional, what I think the key is helping the client reach towards their goals. So if one of their goals is to get out of pain, that is something that at that point you're really playing it as, okay, everything we do is going to be geared towards helping you achieve your fitness goals in the context of keeping things tolerable, keeping them fun, and then modifying as needed. I think one good thing that I'll use with people quite often is the 6-12 24-hour rule, which is 6 hours after you finish an exercise, a lift, if there's some symptoms, keep an eye on it. 12 hours after, keep an eye on it. But by 24 hours after, we want to have someone somewhat close to baseline or +1, -1 above where they were at baseline, so that we're not too often pushing them into a more sensitized state. Yep. The goal is, driving stress, driving adaptations, but in such a way that makes progress without huge fluctuations in pain. Because if we're consistently pushing someone to a sensitized state, that probably doesn't help them long term.
Yeah.
So I think finding the right dose for that individual in that moment.
Exactly. And this is something that, in my opinion, and I assume yours too, personal trainers should know, especially if a personal trainer or strength coach in this scenario that we're talking about, client has been to physical therapy, has been discharged, cleared essentially to continue exercising despite maybe still having some sort of low-level persistent pain. Yeah. Knowing this 6-12 24-hour rule as a fitness professional could be really important because the fitness professional is not performing manual therapy on this client, right? They're not performing a physical therapy assessment and diagnosing. Right. You're simply working with a human that is dealing with some sort of pain. So you need to know from an exercise modification, whether it requires a modification in programming or a modification in form. As the fitness professional, that is 100% within your scope of practice. And that's what we really do at Barbell Rehab is we, at our courses, if I were to run the numbers, it almost comes out to 50-50 of the people that come to our courses, 50% rehab professional, which is what? Physical therapist, PT assistant, manual massage therapist, chiropractor, what have you.
Certified strength and conditioning coach.
Yeah, and 50% S&C.
Yep.
So it's a really good way. And I still get slack about this on social media where people are like, oh, Barbell Rehab is teaching personal trainers how to do rehab, right? That's a very reduction. That's reduced down to literally one sentence. And if you actually read our material, came to our course, you would see that, no, we're not teaching fitness professionals how to do manual therapy, how to do mobilizations. The fact of the matter is, people have pain.
Right.
And how often does a personal trainer see somebody that has zero history of pain, zero current pain, perfect mobility, and no issues whatsoever?
Never.
Exactly. So we call this the unicorn client. So we like to empower fitness professionals to within your scope of practice for how to do this. And I think that'll bridge right into this next scenario of let's take the other scenario of somebody that has not been referred from physical therapy, somebody that comes firsthand to a fitness professional that, okay, let's say the fitness professional, and we'll give you a very specific example. Let's say the fitness professional is having the client do a bodyweight squat on day one, and that client says, ouch, my hip kind of hurts in the front, at the bottom. What within the scope of a fitness professional can that fitness professional do to help that client?
Yeah. So I think in the context of a squat, I mean, we know that there is not one way to squat. There are many ways to squat, and there are many efficient ways to squat. So again, going back to what you said, optimizing form, programming. In this instance, we're probably not talking programming. We're thinking, how can we modify this squat technique to work for the person today?
Exactly.
And I think what you'd probably agree with is that if we can find any way to do it, whether it's modifying depth, modifying style of squat, and that person can now train, well, then you found a really good entry point for that person. You start there, and if for whatever reason you need to progress back into this other style, you do it based upon their goals.
Exactly.
And if along that path you get this person moving, feeling better, everything's trainable, I think you're good to go. If it's an instance, and we've talked about this a lot, but where you on day one you can't get someone because to find a tolerable, sustainable, trainable position, that's when you collaborate with your rehab providers.
Exactly. And to even take that a step further, it really comes down to this. And if within our 4-step framework of training with pain, right? So we have we have this heuristic model in Barbell Rehab where if somebody's dealing with pain, we like to go through 4 steps. So step 1 would be optimize form and programming. And optimize is not necessarily always the right word, right?
Yep.
It's sometimes just finding the form that works for that person. So here's where we draw the line with fitness professionals working with people that have pain. If all it takes is a form or programming modification to instantly change or eradicate somebody's pain, that's 100% within the scope of a fitness professional
100%.
to do.
Yep.
So in our example of somebody with hip pain during squats, knowing what we know, knowing what I just told you, this is not a medical case yet. If somebody has anterior hip pain at the bottom of a narrow stance, toes forward squat, that may be completely eradicated with a stance adjustment and foot flare adjustment. And if that's the case, we don't need to put this person into the medical model quite yet. But if we make those form adjustments and we make sure that the programming is on par, let's say no matter what we do with a form adjustment and no matter how we manipulate programming variables, if that client is still having pain, but even more importantly, if that client is unable to reach their goals, because pain itself is not always an issue, right? It's more or less, is the patient or client having trouble reaching their goals? If they're having trouble reaching their goals after these form or programming modifications, that's when I would recommend referring out. So it doesn't need to be this turf war of if we keep an abundance mindset, right? It doesn't really need to be this turf war between physical therapists stealing clients from strength coaches or strength coaches stealing clients from physical therapists, because the only person that really loses if we make it this turf war is the client. So anything else to add to that about the fitness provider's role when working with somebody with pain?
I think the only thing I would layer in here would be, again, for that person that maybe it's post-surgical and they were in physical therapy and now they're working with you and they still have some limitations, but not because of any reason other than they are out of physical therapy visits. I think that's where the fitness professional and the physical therapist or the chiro should do it as well. That's where you really focus on that collaboration. Because at that point, now as a fitness professional, you're not only helping the client to achieve their goals in terms of fitness, health, wellness, but you're also really almost serving as that extension of that rehab continuum. And so I think in that instance, not only is that a place where, because of the way it is, the fitness professional is going to have to help the client and the physical therapist get them to their goals, but it's also, that's where you make those bonds, and it makes all of these things easier because now you have this provider you've worked with, they trust you, you trust them because you're focused together on the client. So
you just made me think of something else. You know what other profession fills that gap quite nicely? Athletic training. Right? Especially if we're talking a school setting, right? Where the athletic trainer can be that bridge between whether it's the physician, whether it's the physiotherapist, and the strength coach. So I don't want to leave out athletic trainers. Love you guys.
Definitely.
They can be that bridge too. So it's the only big picture here, guys. The only person that really loses if we as providers and coaches don't get along is the client. And we don't like that. So we're here to maximize client outcomes, to maximize and really help clients reach their goals. So, all right. I think we'll wrap that up for the first video, Pain Points. Stay tuned for video number 2.